So, as I understand, we're already online on the Facebook. And good afternoon, good morning, good day, my dear friends, colleagues, partners. And I'm really glad to see everyone again today in one of our expert interviews in the frame of our new project, which we are launching in Ukraine, of the Medical and Wellness Tourism Council. And today, I'm really glad to see as our expert guest, Mr. Ilan Geva from Chicago. Mr. Ilan, good afternoon.
Good morning in Chicago.
Actually, my dear friends, I would like to tell you a little bit about this amazing expert in the healthcare and in the medical tourism. Ilan is president of the Ilan Geva France, and actually he is the adjunct professor of the Chicago University. And in simple words, he is the most well-known person in the world about the branding in healthcare and medical tourism. And Ilan, we would like to ask you a little bit of questions about what is going on nowadays globally in healthcare, in medical tourism. And I would like to start to ask you a couple of words about what is going on in Chicago nowadays.
Well, as everybody knows around the world basically came to a stop in March. This year was some kind of a unique situation that nobody remembers from previous lives. And probably within 1 to 2 weeks, everything stopped. Airline travel stopped. Movement was forbidden from one country to another. Businesses closed. Hospital closed because they were now suddenly 100% dedicated to treat COVID victims. So altogether, we had a very unique situation, and the situation was hurting some countries more than others. The statistics that we read are still not 100% correct because people are still gathering information. But the little information that we do have at this point shows that the situation was very different from one country to another.
Agree.
For example, countries like Vietnam. Vietnam had almost no effect from the pandemic. Now you have to remember, for those who don't know, Vietnam is a country of close to 80 million people. This is a country the same size of Turkey in terms of population. And they had a very, very small number of people that got the virus and extremely low number of deaths. On the other hand, a country like the United States, which everybody looks to as the leader in so many different things, the United States suffered probably the hardest blow from all aspects. We had the largest number of people that got the virus, and we had by far the largest number of deaths. As of this moment, we know in the US of about 110,000 deaths. This is a huge number. True. I mean, it's incredible. So the question that people are asking is, how come? What happened here? And what happened is very simple. Usually, administrations, politicians, governments, they're not trained to treat crisis. And what we had was a first degree of a crisis, global crisis. I'm not even talking about national crisis. I'm talking about global crisis that hit every place at the same time. So from that point of view, it's very unusual. So with that said, we are still learning what is going on, but we now see in many places what people hope and what people think is maybe the end of the virus, the end of the pandemic. And the opinions are very divided whether there's going to be an end or whether it's going to be a gradual getting out of that situation, because, you know, we cannot get out of a pandemic in one day. You don't get up on Friday morning and say, okay, the pandemic is over. No, this is not going to happen.
Yeah.
It's impossible. So we have to think now in terms of what do we do? How do we conduct ourselves into the future? What do we do? And I think that just like when you look at the past and you look at what happened, and you see, for example, Vietnam versus the US, in Vietnam, they will have to do different things compared to what we will have to do in the US. It makes sense because they did not suffer as much. In addition to that, the population in Vietnam is much more disciplined than the population in the US. So I already hear about second wave of the pandemic. Countries that were on the way to see the end of this are now experiencing a second wave, like South Korea. South Korea handled the situation brilliantly. They did all the right things. But it doesn't take much for only few people to bring the pandemic back. And with that, you bring panic, okay? Because now people are really panicking and there is a lot of fear. What will happen? What can we do? So even if you bought all the masks in the world and all the protection gear in the world,
sanitizers and everything, yeah.
Exactly, if you have all that, fine, but we still don't have a medicine for the virus itself, which means that the virus can come back because we don't know what to do about it. The only thing we know is that it only takes one person to sit, let's say, in a restaurant, and the chances are that many people in that restaurant will get it.
Yep.
That we know, but we don't know what to do about it. So from this scenario, I want to move into the business aspect. So what are we going to do in business?
Yep.
So the truth, as far as I heard from my friends and my colleagues, and I'm in touch with people all over the world, the truth is that the business of medical tourism basically came to a complete stop. 100%. And, you know, nobody can tell me, oh, my business continued as usual.
Oh, yeah.
Because that never happened. So what do? We have to actually look at the current situation as if we are starting from scratch. Starting from scratch means that businesses cannot assume that if they were very successful in the past in medical tourism, that the same model that they had before is going to operate successfully into the future. You cannot assume that. There is a lot of work that has to be done in order to bring back not only the customers, because of course you need customers, but to bring back some of your employees.
Oh.
Because you have to think about it. A lot of businesses had to let go of many employees. And many of those employees have moved on with their lives. I know of many people that are now moving from one city to another just because they need a job. So suddenly, some operators of, let's say, dental clinics or cosmetic clinics or hospitals, and suddenly they may not find that they have the same employees. at their disposal. So every business has to do very, very basic things. We have to go back to the fundamentals and plan very carefully what we're going to do in the future.
Nowadays, lots of experts, they're talking about the shifting the trend and shifting the direction from the global medical tourism to localization, to the local medical tourism,
Absolutely.
right? What is your opinion?
I agree. I agree
Yeah, do you
because,
agree on this? And can you tell me,
yeah,
is it
and
possible?
the answer is simple, because the airlines are still not operating like they used to before. So let's say that I live in England and I want to go and
Yep.
do whatever fertility service in other countries, okay? Fertility treatment. I may not have exactly the same flights to those destinations. So suddenly my plan, my dream of going for treatment, for fertility treatment in another country, if I live in England, is questionable. Now, but if I live in France or the Netherlands and I want to go to dental treatment in Croatia, I can drive. I don't need an airline. I can drive, and from what I'm hearing now, even the limitations on driving from one country to another in Europe, many of them have been lifted. And nowadays you can drive freely,
Yep.
at least in the Shenzhen area in Europe, you can drive within the European Union, you can drive freely from one country to another. And that helps. It
But
helps.
talking about US, as you are blocked nowadays, and the US citizens can't fly to other countries due to different reasons, actually, not only the pandemic, but some other reasons as well. Can we tell that the healthcare for Americans may be a little bit costly in order to get these services, and how the American citizens will try to solve this question?
The American problem is very complicated. It is so complicated that it's hard to even know where to start. So we have a combination of things. The healthcare system in the US is not working. It's not working for many years. If you are, if you live in a major metropolitan area and you have medical insurance, your choices are few. You can really choose which doctor, which hospital you want to go to. If you're on Medicare in the US, again, you have quite a few choices because you have basic coverage. But as of now, the current administration in the US, they want to make the healthcare insurance business completely private, and they want to eliminate Medicare. Now, we already have about 40 million Americans that have no insurance at all, nothing, which means
Huge.
that when they are sick, they don't even go to the doctor because many of them are poor because they have no job. I mean, we have 20% unemployment in the US. So these are people that have nothing. They don't have income, they don't have medical insurance. And in addition to that, many of them do not live in major metropolitan areas like New York, Chicago, Los Angeles, San Francisco. They live in rural areas. And the effect of the pandemic on hospital and healthcare services in rural USA was absolutely devastating. Under normal circumstances, many hospitals were closing. I mean, hundreds of hospitals closing every year. And now, because of the burden of the pandemic, and because of the fact that the costs suddenly went really high for all the protection gear and everything else that hospitals had to buy, these hospitals have no money to operate, and some of them are operating on a small budget that will make them alive for maybe 3 more months, but that's it. Now, what do these people do if they need to get medical treatment? Is medical tourism a solution for them? That's a big question because we don't know the answer. We built the medical tourism business for the last 10 years, everybody. You and I, we were going to conferences, we made connections all over the world. It was a good business and people really developed it to a very high level. But because of this pandemic, everything stopped. So we have to start from the beginning. And that's a very, very difficult task. I can tell you, for example, sorry, go ahead.
I just wanted to ask you, taking into account the situation which we are dealing now in US, have with the closing the hospitals, with running the rural areas, devastating situation. Can you tell that the healthcare during this lockdown provided some new directions, new, I don't know, maybe trends in healthcare? Maybe they launched some new programs or simply nothing?
The people that live in rural areas have now, if they need, emergency services, and, emergency, I even call having a baby is an emergency because you cannot wait, the baby is coming. So you need to get to a hospital.
You can't explain to the baby to wait, yeah?
Correct. You can't explain, yeah, we have a situation.
Yeah.
So even that is becoming complicated because the ambulance service, the next hospital, the closer hospital to the location where the ambulance is needed, could be 2.5 hours drive. I mean, this is a big country.
Yep.
So depending on the location and where you are, situations are changing. In the past, until the pandemic, there were some solutions offered to people in Mexico, for example, because Mexico, you can drive to Mexico from many, many places in the US. There are certain border crossings along the border. If you start in California and you go into Tijuana in Mexico, Tijuana developed a whole medical tourism business. And they have many hospitals that you only have to cross the border on foot. You don't even have to drive.
Yep.
And they come and pick you up, and the hospital is 10 minutes away. So those were some solutions for some people, but not all of them. But these solutions were primarily for elective services like cosmetics, okay, bariatric surgeries, dental services, not major. If you have a heart condition, you don't go to Mexico because it still costs money in Mexico and you have to pay cash. Even if it's half the price of the US, it's still expensive for many people, especially people with no work, unemployed.
By the way, talking about these operations, about these general operations and surgeries, are nowadays people are waiting, right? Because no
Yes.
hospital is taking these surgeries. can we tell that, may we assume actually that after the pandemic is a little bit over, that the hospitals will be able to recover their business due to these surgeries which ordinary people are waiting?
So I am personally aware of at least 2 cases, 2 patients with cancer that had to wait for the surgery because the hospital will not take them, because the hospitals were made as centers to treat the pandemic, to treat the virus. So there was a very, very deep concern about admitting regular patients into hospital and performing surgeries while in the same hospital you have coronavirus patients. So they postponed all the surgeries. Now, as of next week, the hospitals here are admitting patients back. But now there is a flood. Suddenly, there is a huge amount of surgeries that are going to take place in a very short time.
So somehow it can help them, help the hospitals to renew their operational side.
Correct. But it can also create bottlenecks in the hospital.
Yep.
Okay, because doctors are going to be, the surgeons are going to be overwhelmed with the quantity of patients that suddenly are coming into the hospital. So we don't know. This is new for everybody. They never had a situation like this before.
Oh yes, everything is completely new, and even talking that we are fully online nowadays, right? And we've been fully offline, even talking about the medical tourism events and everything. So we just need to connect nowadays online in order to get some information from one
Yes,
to another. But
absolutely.
shifting from US to the global world, right? Can we tell that you, as the expert working with the whole world, can you tell that some countries already dealt with this situation plus minus better than the other ones? Maybe you have some cases, maybe you have some advices, right, due to the development of the getting out of this situation for the healthcare providers.
The main advice that I would give to everybody, because there's very few things that I can say to everybody, because solutions that are relevant to one place may not be relevant to another place. But there are some things that could be relevant to everybody. And I would suggest that everybody will go back and examine their situation in the market. And when you go to a business school, you learn about the SWOT analysis: strengths, weaknesses, opportunities, and threats. This is the time to do a SWOT analysis.
Yep.
Look at the situation, and please look at it very carefully and be 100% honest. Don't put in this analysis what you wish for or what you want. Put the facts. So for example, if you're looking at the situation as a, let's say, national situation, you have to examine what is the reputation of your country as a medical center, as a medical destination. Then you have to go down to the level of the city. So, we know that big countries have several medical centers, and the medical centers have great reputation, but you have to assess what is the reputation of that absolute location. I'll give you an example. Everybody knows Mayo Clinic, right? This is
Yep.
probably one of the most famous brands around the world. But not everybody knows where Mayo Clinic is in the US. And the truth is that Mayo Clinic is in a place called Rochester, Minnesota, which is not a tourist destination at all.
Yeah.
You don't want to go there in the winter because it's minus 40 degrees. And yet,
Well, it's also good for the wellness purposes. Cryotherapy.
yes, yes. But despite the, let's say, the poor reputation of the actual city of Rochester, the city of Rochester doesn't matter because they have a brand like Mayo Clinic. So this is a unique situation, but on the other hand, you can have a situation where the destination, like Orlando, Florida, is well known because of Disney World, right?
Yeah.
Okay. But is Orlando a medical center? I'm not so sure. So you have to really look honestly at the country, the city, then you go down to the level of the hospital itself. What is the reputation of the hospital, the actual hospital? And then you can go down to the level of the physicians. Do you have any star doctors? Are the doctors who work for your hospital or clinic, are they brands on their own? Are they famous doctors? Are they well known outside the city, outside the country? Those things can help you. So that's why I'm saying go back to the basics, go back to the fundamental elements of building a brand, which is assessing the reputation that you have, not equipment. I don't care about your equipment, but look at the reputation, look at your history, and then you can decide what do you want to do with it in the future. Now, the second level is how easy is to for people to get to your place, especially now. Especially now. You know, we always talked about travel. Of course, travel is part of medical travel, but we always talked about how easy is the access to your destination. Today, it's more important than anything else. So you have to see what you can do about that.
Accessibility, yeah.
Yes, absolutely.
But I would like to, to clarify a little bit here something. Talking about the brand of the country, brand of the city, brand of the clinic, we clearly understand that the healthcare providers or the wellness tourism providers, wellness resorts or whatsoever, they actually ready to receive the patients and wellness travelers and to treat them as at home. But there is another question, even talking about Ukraine, right? I would just also would like to hear your opinion about Ukraine. Are the brand of Ukraine globally as the country and cities of wellness and medical tourism they are not, I would even tell, well known. They're not known for many countries, for many cities. And we both of you understand that the governmental bodies have to put their hands inside in order to promote the country and the city. So the situation in Ukraine nowadays is the following. We have clinics, we have good surgeons, doctors, therapists, but the brand of the country is not built at all at the moment, right? So what can, in this situation, what can the owners, the managers of the clinics, the hospitals, the wellness resorts do in order by their own strengths, by their own resources to attract the patients, those international patients and wellness travelers to whenever the borders will be open? What is your
So
suggestions
again,
to
I'm going to
them?
give you a general suggestion because, again, you know, for me, when I work on a
Yeah.
brand, every brand is different, okay? And every brand has to be different because you cannot be like somebody else. You don't want to be like somebody else. You have
Yep.
to try and be as different as possible. So we have today opportunities that we never had before. And I think that today, with a little bit of help, professional help, the budgets of self-promotion and marketing, they do not have to be very big. Look what we are doing now. We are on Facebook. We're going to be on YouTube. Everything that we do now doesn't cost anybody anything,
Just the
right?
time. Yeah,
Yeah,
just the time.
yeah.
Mhm.
So it's 1 hour of my life.
Yep.
Okay. So doctors hate to do marketing, and they also don't know to do marketing, honestly. But they have to.
Yeah, that's what I wanted to add. Yeah, they just don't know.
They have to. They have no choice. If you want to stay alive, you have to do social media. You have to write articles, maybe write books. I don't know what. You have to make yourself a brand. And it's not going to happen just because you finished medical school.
Yep.
No, there's thousands of doctors, and you have to show me, the patient, you have to show me why I should choose you. Okay? And for that, you must understand marketing. And yes, you can get help on the side. You must maybe consult with somebody who can help you. But at the end of the day, the work is your work. Nobody is expecting doctors to do print campaigns in magazines and
Yeah, yeah.
television commercials. No, this is old. But we have these wonderful opportunities and we have to take advantage of them. You know, I'm very active on LinkedIn and I write articles, I voice my opinion, and that's how people know me. I have thousands of followers, and that's because people know me because I'm active.
And
Okay,
again, it doesn't cost you some special budgets, let's call like this. It's just
right,
your time,
correct,
which also costs money, but just it's your inner time.
correct.
So we may tell, we may tell. Go on, go on.
Even a website. You know, a website is considered to be the most basic thing that you must have so that people in other countries, when they start a research about you, they can go to a website and get information. Don't do a website that looks like everybody else. And I see thousands of websites, and believe me, they all look the same. I cannot tell the difference between this and that. There is no personality that comes out of the website. And so these are the kind of things that doctors and clinics and hospitals should consider if they want to get back into the circle, because the patients out there are also starting from scratch. I don't know what have changed with the patients, the consumer's mind. I don't know because I didn't do a study. These things are still changing every day. So I don't have exact information. But I can tell you that my feeling is this. Today, if, let's say, a potential patient in Europe, only in Europe, regional, not global, but regional, if a potential patient in Europe will start searching for solutions for a condition, the first thing they will do is they will go online. 100%.
Especially nowadays when all people
Yes,
start to understand the online.
absolutely. So if they have questions, you as a clinic or a hospital, you must have a 24 hours service that can answer all the questions. You cannot go home at 5 o'clock and say, that's it, I'm done. 24 hours, 7 days a week.
By the way, talking about the online and taking into account that majority of people, even the ones who didn't use internet before a lot, nowadays everyone I think can use internet. May we predict that this skill of people to be online and to search information online may somehow influence the business of the medical tourism facilitators? Because before, people didn't know how to search online. They've been going to medical tourism facilitators for a consultation or something like this. Now they know how to do it online, and it may damage the business of the medical tourism facilitators as well. What is your opinion on this?
Okay, so I look at the medical tourism facilitator just like I look at my travel agent. Believe it or not, I have a travel agent.
Yep.
Why? And I'm very savvy. I mean, I know how to get tickets to a lot of flights, and I know how to get the best price. I know how to get the best seat. I know everything, but I'm not an expert. So if I have a tough situation that I cannot solve, I go to a professional. And
Right.
believe me, there are still travel agents. They're very good, and they have access to technology platforms that I don't have. The regular person doesn't have access to the media platforms and the technology platforms that the professional travel agents have. And I would like to believe that some of those issues exist in medical tourism. I know personally, I know some facilitators that if I want to really be at peace about making a decision, I trust them to do everything. When I say do everything, they will book the flight, they will book the hotel, they will do everything. They will arrange a visa. Whatever is needed for my situation, they will do because they're good.
Yep.
So
So
these facilitators are also brands in the business.
it's a good supporting advice, I would say, for them and point of view, which you just shared. And that's why our dear friends, medical tourism facilitators, you have rights to float again in the market. So just be strong and just as you are adamant. By the way, we had a question from the audience about the wellness industry nowadays, right? And how the wellness industry may help to recover about after the coronavirus.
This is a great question. One of the things that I really believe in is the wellness industry. Now, the world needs the wellness industry right now because everybody is stressed, okay? Everybody has gone through very hard time. The wellness industry, and again, the wellness industry is a very big term, but if you break it down to what kind of services you can get within the wellness industry, it's wonderful, it's great. I am dreaming of being able to fly out of the United States to a specific place in Europe where I can just relax, have a great massage, have the best food in the world, have a nutritionist that will look at my dietary habits and give me advice how I should, because, you know, I was sitting at home for 3 months eating like a pig. So enough.
All of us, I would tell.
Yeah,
Yeah.
and I didn't do exercise, you know, because I'm sitting here doing webinars. I need a break, and I'm not the only one. There's millions of people who need exactly the same break like me, and they're willing to pay for this, and they're just waiting for the right moment. And they're waiting to connect with the right brand that fits exactly their needs.
Also, we need to point out here that people are looking nowadays for the holistic approach,
Correct.
because in their mental system and physical body state, everything is a little bit, shaken. That's why they are looking for the holistic approach.
That includes psychology,
Yeah, that's that
because, you
is
know, there's people are going crazy. You
yeah, it
know,
is. But I'm sure that our industry will recover very soon, and the medical and the wellness tourism industry will get back to its positions in the nearest this or maybe early next year. What
I
what are
hope
your
so.
what are your prognoses actually as the global expert? Maybe tell that this coronavirus and this lockdown, um, besides of the minuses which we have, gave us some pluses. May we find some pluses of this situation?
So I look at this as an opportunity. You know, when I was talking about the SWOT analysis, there is opportunity. The opportunity that I see for everybody who is in this business is to look deep inside into their capabilities and what they promise and what they can actually deliver, and make sure that what they do in the future is nothing but excellent. Absolutely excellent. Do not cut corners. Don't try to save money on stupid things. Do the best to be an excellent business, because the people that will come back, if they will be disappointed only from one thing in the total experience of going to another country, which includes the airline, the ground transportation, the accommodation, everything, if they will see something that doesn't work, they're going to blame the country,
Agree.
not necessarily the airline, but they're going to say, oh, I went to Italy, it was horrible. Why? Because the airline really sucked. No, you know, you have to strive to be able to provide excellent services in every touch point. And that's where the private sector should collaborate with the public sector, meaning the government, to provide everything on top level, 5-star level. It's a must. But that's the opportunity, because I think that after this, people may forget things from the past, and they will give everybody a chance to start from scratch.
Or reevaluate the things actually.
Correct.
Right? Yeah.
Correct.
So, from all our conversation, which actually was brilliant, and I've heard a lot of suggestions and a lot of advices from my side, actually, which the clinic and the wellness hotels and the wellness resort owners and managers can use, actually. But the first thing which we never have to forget, this is the branding, the inner branding, the outer branding. This is something that every company has to follow, has to know their mission, their visions, their values, and only after that to be opened to provide the services to the international and local patients and the wellness travelers.
Absolutely correct. The focus of my business is to help people with the internal brand. And only after they have a good internal brand, they can talk to the world and do the external work. But it is extremely important because the performance of the brand is what people see. You know, a brand is only what people say about you. It's your reputation.
True.
It's not your logo. It's not your advertising campaign. Not at all. So if people think of you great things, then you have a good brand. But you never stop training your people, learning from mistakes, going forward all the time, listening all the time to your customers, understanding what kind of experience they have, so that every little point can be improved along the way. And some of the most successful brands in the world are doing it all the time. If you look at the Ritz-Carlton, the Ritz-Carlton is a brand that they get together employees every Friday to discuss everything that happened to them during the week. And they listen to each other, they learn from each other, and then they know what to do next. That's why the Ritz-Carlton is the Ritz-Carlton. And that's why people go there and they're happy to pay a higher price because they know exactly what they're going to get.
Yeah.
So the internal branding
But
is
the question
the most
is
important.
that, and actually it's opportunity. I would like to invite you to be our invited expert in order for Ukrainian healthcare and wellness tourism providers have the opportunity to get the experience and knowledges from you.
I would be honored.
Thank you very much. And
Thank you.
actually, I'm really thankful for your time, that you found this time early in the morning. And I am really will be happy to see you personally this year, or maybe just early next year in
I
Ukraine or
hope so.
any other conference globally.
I really hope so. I'm looking forward to it. Thank you
Yeah,
very much, Anna.
thank you very much. Thank you. Have a nice day ahead.
Take care. You too. Bye-bye.
Bye-bye.